Hi there, I'm Dr. Kari Hough. I'm a pelvic health physical therapist and a physio coach here at Rechare. Today I want to talk to you about pelvic pain, specifically pain with intercourse. Now, pelvic pain is sort of an umbrella term, and there are a lot of conditions that can fall within that term. Specifically, today I'm here to discuss dyspareunia, or pain with intercourse. You could also have pain when inserting a tampon, or maybe pain with a vaginal examination. All of those would be relatively similar. Now, there are a lot of etiologies behind pain with intercourse. Things like endometriosis, vaginal dryness, but one of the most common things that I see as a pelvic health physical therapist is actually attributed to your pelvic floor muscles. So if your muscles aren't relaxing, it's going to make it difficult to allow for penetration, because your pelvic floor muscles actually surround your vagina. What I really want women to know is that sex should be pain-free and it should feel good. If none of those things are happening during intercourse, you can absolutely come see me here at Rechare if you're in the Howard County area. If you're not, you can still contact us and I'd be happy to help you find a local pelvic health physical therapist near you. Now, while I can't give medical advice without seeing you one-on-one, I do want to share a few techniques and tips that could possibly help if you're experiencing any pain or discomfort during intercourse. Tip number 1 is try to relax. Now, I know that's much easier said than done, so if every time you've tried to have intercourse, it's been painful, your mind's already starting to think, well, this next time that I'm gonna go have intercourse, it's going to be painful. That can cause a lot of anxiety and stress on our body, which is not going to help us to be able to relax that pelvic floor to allow for an easier penetration. There are a lot of positions or stretches that you can do for relaxation, but today I'm gonna show you one. And what I want you to do in this position is to breathe. So we know that diaphragmatic breathing is really good at helping relax our pelvic floor. So the stretched position that I'm going to put you in has the pelvic floor nice and open. As you take a big inhale, you should start to feel that pelvic floor start to relax. The position I'm going to show you today is called Happy Baby. So you're going to start off lying on your back. Bring your knees gently to your chest. Place your hands on the inside of your feet and you'll gently pull your legs apart, almost like a squatting position. Once you're here, I want you to take some big diaphragmatic breathing. All that means is that you're filling your belly with air as you take an inhale and letting everything relax as you exhale. Cycle through multiple breaths until you can start to feel that pelvic floor release some tension. Not only could you perform this stretch maybe a few minutes or hours leading to intercourse, this is something you could absolutely include on a daily practice. So maybe a few breaths in this position in the morning and at night, hopefully that will start to down-regulate that pelvic floor. The second tip that I can give you today is position. Now, sometimes when we're in the heat of the moment, we don't really think about how our bodies are positioned, but it can play a role in what area of your pelvic floor is taking on a little bit more of the penetration. So the biggest tip that I can give you is if you have found that you have one-sided pain, lie on your side, put your painful side up. What we're looking to try to do is to put you in a position where your pelvic floor muscles can relax more and be a little less engaged. So whether that means for ladies, we're on the bottom and your male partners are on the top, or again, if you're side lying with a painful side up. The most aggressive or intense, I should say, position for females will be to be on top. So you might want to try to play around with that and see if you can alleviate some of the pain just through positioning. My last tip for you today is lubrication. Now, what you want to look for in a lubrication is a glycerin-free, paraben-free, water-based lubrication. Any of the traditional lubrications you might see, well known, the KY jellies or the Astroglide, those are often filled with alcohol, which can be very drying for your vagina. Your vaginal tissue is very sensitive, so you need to make sure that you're providing it with lubrication that will moisturize and seal in the moisture. For pelvic exams here at Rechare, we use Slippery Stuff. It's the blue version, their personal lubrication gel. It's water-based, again, paraben-free and glycerin-free. So this works for not only pelvic exams, but also intercourse. So if you're having somewhat of a burning sensation during penetration, the lubrication is absolutely something you can play around with. So just a quick recap, my 3 tips today for painful intercourse are relaxation and breathing, position, and lubrication. Now, it's easy for me to sit here and to give you all of these tips, but please understand that an individualized approach is of course always the best way. So if you're finding that you're still struggling with painful intercourse after trying these tips, please reach out to me here at Recharge and we can get you scheduled for your one-on-one.